So welcome all to the webinar around Test and Trace. So looking at how we can all work together to support the Test and Trace system to get on top of the coronavirus. My name is Emily van der Venter, Associate Director of Public Health, and I will just go round our panel members to let them introduce themselves this morning. So if I start with Jerry from Rugby Borough.
Yeah, Councillor Jerry Roodhouse, Rugby Borough Councillor in the Paddocks Ward, which is the eastern half of Rugby, but also a county councillor, and Healthwatch Warwickshire.
Great, good to have you with us. Thanks, Jerry. And Les Caborn from Warwickshire County Council.
Yeah, good morning, everybody. I'm Councillor Les Caborn, and I'm Cabinet Member for Health and Adult Social Care, Chair of the Health and Wellbeing Board, and Member Lead for Test and Trace.
Thanks, Les. And Emma Crane from the Borough.
She sent her apologies, Emma.
Ah, okay, thank you. Do we have somebody else from the Borough? Is Michelle with us?
Hi, I'm here today, Michelle Dixon, Community Projects Manager, Rugby Borough Council.
Great to have you. Thanks, Michelle. And Bill Basra, thanks for joining us today. Over to you.
Yes, hello. Good morning, everyone. Bill Basra, Chief Exec of Bedworth Rugby and Nuneaton Citizens Advisory Board.
Thank you. And my colleagues Alistair and Amanda are supporting the webinar as well. Do you want to introduce yourselves?
So yeah, my name is Amanda Wilson-Patterson. I'm the Localities and Communities Officer. I cover the Stratford district, but currently covering for Jen McCabe, who's your LACO in Rugby, who's currently on maternity leave.
Yeah, I'm Alistair Rigby, play a similar role to Amanda, but for Warwick District, and also covering for Jen McCabe as well. She's on maternity leave.
Thank you all. So as I say, in terms of the format of today, we'll do a short presentation and then we'll go on to question and answer session. We've had some pre-submitted questions and also space for people in the audience to ask further questions today. So just a reminder to please turn your microphones off if you're not speaking, and if you're not on the panel to please turn off your video cameras. So the title slide for today. So this is all about how we can work together to support communities as we come through the pandemic. So as I say, a little presentation and then over to questions. So we'll cover what support is currently available to communities. We'll look at the pattern of cases within Warwickshire to date, then touch on key prevention measures that we should all be taking. Then we will move on to what Test and Trace is and how it works, and then a short slide on how you can help us.
Thank you, Emily. Yeah. So yeah, this webinar this morning is aimed at those pop-up groups, those mutual aid COVID-19 groups that popped up all over the county in the last 12, 14 weeks or so. And as you can see from the slide, over 300 groups responded heroically to the crisis, and in Rugby, 56 of those popped up and hopefully are still around. All the details of every group are on the Warwickshire County Council's COVID-19 Community Support Directory, so you can go direct to the County Council's website. The link is there, and you can keep in contact with each other or let each other say hello to each other and find out what each other are doing and maybe support each other going forward. Can we have the next slide? Okay, as ongoing support, the Localities and Communities Officer, of which myself and Amanda are two, can be a point of contact for the COVID-19 groups. So please bear that in mind, and our contact details are there. Mine's not there, but Amanda's is there.
Thank you, Alistair. So before we went any further, we wanted to just pause and say a big thank you to all of those support groups that came together during the pandemic. we're not out of the woods yet, but we've come a really long way with the help of communities. Really couldn't have done it without you. The impact on the NHS thankfully wasn't as bad as we feared, but it's been so helpful to know that we've had people in the community that we could call upon when there were local residents that needed a little bit of extra help. So I know many of you were supporting people who were shielding to help get access to essential supplies, and that was really valued by all parties. So whether you were working in the public sector, the voluntary sector, or just helping out neighbours in your local area, a really, really big thank you for coming together at this time. So this is the pattern of cases that we've seen in Warwickshire since the start of the pandemic. So you can see the peak there, which we've come through, and now it's starting to level off. We're having a few cases kind of popping up here and there. And Rugby actually had been very low for some time, but we are starting to see a few cases popping up in Rugby. So really important to have your interest and support with getting those prevention messages out and getting people to understand the test and trace system and what to do if they have symptoms. So again, thank you for coming today. By working together, we can really knock the virus on its head and get to the end of this pandemic sooner rather than later. So in terms of preventing the spread of coronavirus, the key messages remain as they were. So stay alert to symptoms, key ones being a high temperature, a new continuous cough, or a loss or change in taste of smell, in taste or sense, can't speak, taste or smell. So the vast majority of people have at least one of those symptoms, may well be coupled with other symptoms such as headache, achy muscles, fatigue, but one of those three symptoms, then as soon as you have those, do isolate and request a test. And we'll come on to that a little more shortly. In terms of the wider prevention messages, hand washing is still absolutely critical. I'm sure everybody was really on it towards the beginning of the pandemic, but please don't forget to keep that up. Face coverings, the poster here highlights that we have to wear a face covering on buses. They also need to be worn if you're attending a hospital or an outpatient appointment. And from the 24th of July, it's mandatory for them to be worn in shops as well. So I think just to encourage you really, if you're going to be in an enclosed public space coming across people that you don't normally come into contact with, then wearing a face covering can help protect others from you really, in case you are asymptomatic or in case you picked up the virus and not yet showing symptoms. Wearing a face covering will help to reduce the spread of droplets. So it's really important to help protect each other and particularly our vulnerable residents. And then the Catch It, Bin It, Kill It poster, it's been around for many years, so I hope it will be familiar for some of you. It's often pulled out at winter time as we go into flu season, but really important. So if you are going to cough or sneeze, try and do it into a tissue. If you haven't got a tissue at hand, cough into your elbow, and make sure you wash your hands to kill any remaining virus that may be on your hands. So soap and water is always the preferred means of cleaning your hands, but if you haven't got access to that, then hand sanitizer with alcohol content of at least 70% is recommended. So on to test and trace. So this is the name of the contact tracing system, which, to be fair, has always been there. Public Health England have always had a contact tracing function, but obviously we've had to really ramp it up and scale it up across the country during the pandemic. So we've got a bit of a blend of a national, a regional and a local system. But it's absolutely vital in terms of controlling the virus and really getting on top of it in these coming weeks and months. So following a case of a disease, any disease, but obviously we're talking about coronavirus in this situation, once it's identified, then we need to identify where that person potentially picked it up from and who they have had contact with to ensure we can get messages out to them to isolate, to prevent any further spread. So in terms of the symptomatic or the infectious period for coronavirus, is whilst you're symptomatic, so whilst you've got any symptoms, and 2 days before the onset of symptoms. So that's really key. And that's why we ask contacts to isolate, even if they haven't got symptoms. So generally, when you're a case, you will be symptomatic for 7 days 2 days before the onset of symptoms, and then a further 7 days during your symptoms or until well. So you may have a cough that remains, but if your other symptoms have subsided, you're unlikely to be infectious. So we really need to do this contact tracing so we can understand if there are any clusters starting to emerge and get on top of those, causing any wider community impact. So once we know of a case, we will put control measures in place, largely where we've been seeing at the moment kind of sporadic cases within workplace settings, because there's been such good uptake of social distancing advice and workplaces putting in all those measures that they're advised to be a COVID secure environment. We're generally not seeing transmission within the workplace. So I think that's really reassuring in terms of highlighting that those social distancing measures are working. And obviously then, as I say, we get in touch with close contacts, and I'll come on to what we mean by close contact shortly, to make sure that they can self-isolate and also that they're aware of the symptoms. And if they develop symptoms, then they would be required to get a test. And obviously, if they're positive, you go on and do further contact tracing. So this graphic, I hope people will start to become familiar with. It's the key one that outlines the steps of the test and trace system. So I'll start with the blue square. So if you get any of the coronavirus symptoms, so high temperature, new continuous cough, or change in taste or smell, then you must start isolating for 7 days. So if you yourself have a positive coronavirus diagnosis, you self-isolate for 7 days, and that really does mean avoiding leaving the home, so not going out to do any shopping and trying to get others to help you if you need to get food or essential supplies in. If you live with other members in your household, they will be asked to isolate for 14 days. Now, the importance of that being a longer period is because of the incubation period for the virus. So that gives enough time to work through that incubation period. And if you haven't developed symptoms in those 14 days, then we can be confident that you haven't been infected. So if you get those symptoms, you, as well as isolating, need to go and book a test. That can be done through nhs.uk/coronavirus, and you'll put in your details. It'll take you through a series of steps advising you where your local testing unit is located and how to book on, or enabling you to request a postal self-test kit. I would say, if at all possible, please do try to get into a drive-in test centre. The results from those centres are turned around within 24 hours. Obviously, if you go through the postal system, it does take a little bit longer. You can also call 119 if you haven't got access to the internet to request a test. So if the test comes back negative, then you can stop isolating immediately. There's no, obviously further issues, but we would say so long as you feel well. So if you're poorly with something else, then obviously don't go back to work and risk spreading a different disease around the workplace or within public. So as long as you're well, you can stop isolating along with your household. However, if you're positive, then that's when you would get contact from the NHS Test and Trace system, and they would ask you to share details of any close contacts from the 2 days before you were symptomatic and then whilst your symptoms are present. So if you're then identified as a close contact, moving on to the yellow side of the slide, you'll be contacted by NHS Test and Trace and asked to isolate for 14 days. If you develop symptoms whilst you're on that 14-day isolation period, then you need to book a test. If your test comes back negative, your household can stop isolating, but you are still a contact of a confirmed case, so you would be asked to complete your 14-day isolation period. The validity and the robustness of the test result does depend somewhat on at what point during the incubation period you're tested. So really the best time to get tested is between the kind of 2 days before onset or the first 5 days of being symptomatic. So there is a chance still that you could be incubating the disease and yet still have had a negative result. So that's why you're asked to complete the full 14 days in isolation. If you come back positive, then you would start a new 7-day isolation period. So you're now a positive case, so you remain isolated from 7 days from when you had your test taken and that test being positive. And your wider household contacts would be asked to isolate for 14 days. And obviously, we would go through the same system in terms of treating you as a case and trying to identify your wider close contacts. So when you're contacted by Test and Trace service, this is what they will run through in terms of trying to identify your close contacts. So looking at family and household members, as I say, they'll be asked to isolate for 14 days with you. If you've had any close contacts in the 48 hours before your symptoms started and during your symptomatic period, they will try to identify them, ask for contact details for those contacts so that they can get in touch with them and ask them to isolate. They will also look at where you've been recently. So if you've particularly been to a GP surgery when there might be other vulnerable people, or if you've been at work, or if you visited local cafes or restaurants or bars, they would record those details. And obviously local bars, etc., are being asked to capture the details of people that visit their premises so that they can do that further contact tracing where it's people you might have had contact with who you don't actually know. So where possible, please provide details to our contact tracers. In terms of the definition of a close contact, there's a few elements that come into play there. So if you've had face-to-face contact with somebody less than 1 metre away for any period of time, that would count as a close contact. If you've spent more than 15 minutes with somebody within a 2 metre distance, then that would count as a close contact. Or if you were travelling in a car or a small vehicle, that's also a close contact. So you can see why maintaining that 2 metre social distance is still really important, because it will reduce the number of close contacts that you have had and therefore reduce the risk of transmitting the disease onto additional people. So if you're asked to isolate due to being either a case or a close contact, you're at work, then your employer should support you in that, and you are entitled to sick pay. So hopefully that's easy enough to understand if you're actually a case and you're unwell. If you're a close contact, so you're not currently displaying symptoms but you've been asked to isolate, then your employer could ask you to work from home if it's possible to do so. If it's not possible, you still need to stay at home, so you would be entitled to sick pay. And I've put a couple of links there to some guidance if people need further information on that, but we'll also come to Bill from Citizens Advice a little later to talk about that. So how you can help us with the test and trace system and with beating the coronavirus and getting to the end of this pandemic. So as I've already said, making sure that you do provide your contact details when you're visiting public places. And for some settings, this might feel a bit strange to do so, but it does mean that once we're aware of any cases who have been present in those venues whilst potentially infectious, we can get into motion really quickly to identify and ask those contacts to isolate. Social media is obviously a really helpful platform in many ways to get messages out, but it can also be a risk around some misinformation. So we would ask you to have a look at those hashtags. If you look at Warwickshire and those hashtags, you will find posts that we have been sharing, and would ask you to help us in getting that accurate information out to your contacts within the community. And if you're keen, the second link I've popped up there, so coronavirusresources.phe.gov.uk, has got a whole wealth of posters and information that you can download and print off. So, you know, you could help us by putting some of those up in your local community, in local corner shops, etc. I'd also ask, I know many of you have already been supporting each other during the pandemic, and I'd like make a plea really that you help us in continuing to support each other. So that maybe if people have been asked to isolate through test and trace and they need some food or medication picking up and bringing to them, then please do so. Obviously do that in a safe way, so don't enter the home of somebody with coronavirus, but leave items on their doorstep. If people have been shielding, then the formal advice and support for these individuals does come to an end at the end of this month. However, many of them are likely to be still feeling a little bit anxious about going out and about, so may need your help for a little longer in terms of getting hold of essential items, and perhaps just a little bit of support in terms of encouraging them out and helping them to have a little bit of outside contact in a safe way. I also want to flag looking after people's mental health and well-being. I'm sure we've all struggled during this time. It's completely unprecedented. It's very difficult not knowing how long it will last. And people who have obviously been ill or have lost people to coronavirus will have experienced a very difficult period and a very unusual bereavement experience. So the main message is it's okay not to be okay. As I say, it's absolutely normal for anybody to be struggling at this time. We're all coping differently and facing different challenges. So please just look out for each other's mental health. If you're worried about somebody, we've got lots of information on the Warwickshire County Council website around mental health and wellbeing support that's available, and we will send out packs of information to you all in the audience at after this webinar. I would encourage you to ask twice. So if you ask somebody if they're doing okay, you know, most of us will come back and say, yes, I'm fine, thank you. But maybe ask twice, ask if they're really okay and put some context around that. So just recognise that, you know, this is a really difficult time. Are you sure you're okay? Just giving people that permission to open up can be a real lifeline. And then in terms of if you have any concerns about breaches of coronavirus measures, or you have any concerns, for example, of employers or workplaces not putting sufficient prevention measures in place, then do please report it to Warwickshire Police. There's a link there, sorry it's quite long, but that link will take you to an online form where you can report a breach, and you could also call them on 111. So rather than use the emergency number, suggest you would use 111 in that scenario. So that's it in terms of the presentation. I do have a few pre-submitted questions. I'll just stop sharing my slides at the moment. So we'll have a look at the pre-submitted questions, and I will take those to the panel, and following that then please do pop anything in the chat if you've got additional questions or comments you would like to make. So the first question, I think the first couple are for me. So how and when do I get tested, and when do I get the results back? So as I say, you can go to nhs.uk/coronavirus and request a test through that system, or you can call 119 to request a test. If you go to a drive-in testing unit, you will get the results back within 24 hours. If you opt for a postal kit, then the advice is you will have the results back within 5 days, hopefully sooner, but obviously demand on that system and delays with postal mechanisms can cause a bit of a delay there. In terms, the next question is, can I go to my GP with COVID-19 symptoms? So would just make a plea that you don't just turn up at a GP surgery if you suspect you have coronavirus. Please call your GP beforehand. If they need to see you face to face, they can make arrangements for doing so. But obviously we don't want to put other people in GP waiting rooms at risk. So just call before you go anywhere. So then I have a question. This one was going to go to Emma, but I think she's given her apologies. So if I take this for now, so what are employers expected to do to reduce the risk of spreading the virus in the workplace and to help test and trace? So there's a load of guidance that has been issued around being a COVID secure workplace, and this is what workplaces need to be following. So it looks at implementing social distancing where possible. If it's not possible, then they need to consider what mitigating measures they can put in place. So that might be having people stand side by side rather than face to face, and putting a protective screen or barrier in between individuals. It also requires them to have appropriate cleaning products in use. appropriate use of toilets, having hand sanitizer available to colleagues, and obviously ensuring that they're supporting people not to come to work if they are symptomatic. We're also starting to look at things like ventilation within workplaces to help reduce the risk of any spread. In terms of test and trace, then if any cases occur in a workplace, that workplace is required to support us in identifying any close contacts within the workplace. If it's a public-facing venue, then as I've said, they need to be recording the details of people who visit. So be that a hairdresser, a beauty therapist, a cafe, they should be collecting contact details from individuals. And so that means when we do, as I say, have a case associated with that venue, we can act really quickly to identify and isolate those contacts. So another question around what happens if there's an outbreak in the workplace. I think I've touched on that really. So an outbreak definition is 2 or more linked cases within a setting. So if there's a single case in the workplace, they have to report that and obviously isolate them, and the test and trace system will come into play to identify their contacts. But if there are 2 cases within a workplace setting, then we will call an incident meeting with Public Health England, Public Health from Warwickshire County Council, environmental health officers from district and borough councils, and the manager or HR representative from that workplace to make sure we can run through what mitigation measures they've got in place, what else could be done, and as I say, to make sure we're identifying and isolating all of the relevant contacts. So I think that's enough talking from me. So I will look at the questions for other colleagues now. So if I can go to Michelle, and perhaps Alice or Amanda might want to comment on this one as well. But what if I'm told to isolate for 2 weeks and I have no food in the house and no one who can help do my shopping for me? What are people's options? Michelle, do you want to come in on that one?
Yeah, okay. The council has a comprehensive list of voluntary groups that we collated at the beginning of this, people that are able to potentially help and support within the community. We've got some dedicated web pages on our website, which are really comprehensive in terms of information. We've also published information on local businesses that are providing home deliveries to people. What I would say though is if you're struggling with access to the internet, then obviously call our call centre on Rugby 533 533. The County Council has collated a really useful guide as well on how to secure food supplies, and it might be worth circulating that around the group, Emily, as part of today. The council can also, if we have got concerns that you haven't got any arrangements, we're able to refer people to the NHS Volunteer Responder Scheme with a view to potentially getting support with shopping, collection of prescriptions, and also, as you touched on earlier, Emily, the important issue of befriending. I have found out in the last couple of days, actually, I don't know if the guidance has changed, but charities and other voluntary and community sector organisations can also become approved referrers to that scheme as well, to make referrals on behalf of their clients and their community. So if one of the VCS organisations wishes to become a referrer, then they need to contact england.covid/communities@nhs.net, and I'll put that in the notes column.
Brilliant, thanks Michelle, that's really helpful. So yeah, good call. We can get the information around food supplies circulated along with the link for the NHS volunteer scheme as well. Thank you. Amanda, Alison, is there anything else you wanted to add on that?
No, just to say that I've actually put the central government helpline actually in the chat. So the 0800 number that Michelle's just referred to, I've actually put that in the chat for people.
Brilliant, thank you, Amanda. Okay, so one for Bill Bazra now, Citizens Advice. What should people do if they have any concerns about their employer not supporting them to self-isolate?
Okay, so there's considerable guidance on the gov.uk website, Health and Safety Executive, and also National Citizens Advice have a dedicated page for exactly these types of queries that can be accessed through the national website. Individual cases are likely to be different. So before I go into what the general advice that we would give is that my first port of call and recommendation to any employee who's got concerns is to give their local citizens advice a call, and because the circumstances are likely to be different, depending on who your employer is. What we would say is that on a general level, it's important to emphasise, and this is the advice that we're giving to employees, that the various measures taken under Covid-19 are an integral aspect of health and safety legislation, where employers have a general duty of care that employers have to protect workers from harm and from harming others. So if you take that general duty and apply it to COVID, then certainly if an employee has to self-isolate, then employers should not be asking them to come in. They should be respecting self-isolation. Every employer should have a risk assessment as well, and that should be shared and consulted with staff. And within that risk assessment, there should be reference there to what happens where there's a potential case of COVID-19 within the workplace and the rules that apply to self-isolation. So, certainly, again, our advice to employees would be, if in doubt, ask your employer for a copy of that particular risk assessment. One of the inquiries that we've had come through our telephone and email advice is if symptoms are present and the employer is asking me to come in and I don't come in, then will that lead to detriment? Will it affect my employment in the future? And what we point to is that the Employment Rights Act of 1996, there's a specific section in there, section 44, which says that employers may not be subjected to a detriment because they have raised a relevant health and safety concern to their employer. So, there's two issues here. One is that under the general duty of care, employers need to respect self-isolation as an extension of their health and safety responsibilities. And then the other one is that if an employee raises that with an employer, then their rights are protected also.
Absolutely. Thank you, Bill. I think that's really helpful to point out to both pre-existing and current COVID regulations that give employees those rights. So please do feel empowered if you're concerned about anything in the workplace to challenge your employer. If you still have continuing concerns, then you can get in touch, as I say, with the local police or trading standards who can help to enforce and talk to your employers as well. And as Bill has said, it's worth giving citizens advice a buzz if you have concerns over your particular individual circumstances that you're concerned about. Thanks, Bill. And then finally, from pre-submitted questions, there's one which I think I will pose to Jerry and Les. So someone has asked, might we have a local lockdown like they've seen in Leicester? Jerry, can I go to you first?
Yeah, well, I hope not, for a start. But I think what we have seen in Rugby, for instance, the Rugby population has been pretty good in the way of following the guidelines. If you look at the numbers across Warwickshire and England, we've kept fairly low numbers, but what we have seen recently is a little bit of a spike, though the numbers are still low, and they're being monitored on a daily basis. And the Director of Public Health, Sade, is looking at those and is sort of disseminating that evidence back to the Rugby Borough Council and others concerned. So it's really a case of following the guidelines and keeping that social distance and keep going down that particular route and following the hygiene measures especially. But the numbers are fairly low, but we mustn't lapse back, I think, is the question. And just on community groups, I've noticed now that a lot of community groups are evolving into either good neighbour schemes or, going forward. So the hope is that they will now continue with befriending, supporting people in the community as well, which is great to see. Absolutely.
Thank you, Jerry. Les, is there anything else you'd like to add on that point?
Yeah, I just totally support what Jerry has said, and I think the worst the worst rate in Warwickshire only ever got to half of what Leicester was. So no, we monitor Leicester. We have monitored the traffic going both ways and people going both ways. So we're well aware, and we hope it was an isolated incident. But we can, as Jerry says, we can never say never. What I think we can say though is having got the new powers over the weekend, so we can sort of close down an individual premise on something like that. Then that gives us the chance to catch early. We also, so everybody's reassured, got access now to 7 of the portable test and trace units. So we've got access to 7 for Warwickshire, so we can get one at an individual site or in an individual town very quickly. We've also, in conjunction with our boroughs and districts, have identified sites across the whole of Warwickshire where we could put one up quickly. So that gives us some reassurance that if there's a minor outbreak, as you've said, two or more people in a closed environment, we can get something in the area and try and get to the bottom of it very quickly.
Absolutely.
We'll never say never.
Absolutely. Thank you, Les. As you say, hopefully those additional local powers will be a way that we can get on top of any emerging situations quickly, preventing the need for a full lockdown. But yes, we will be able to stop events, close premises very swiftly, things that we've kind of struggled with a little bit to date. So that additional legislation will be really helpful in that. So
just on that, Emily, I've asked Sade to do a simple breakdown of it. We'll certainly get that out as widely as we can. Then that'll be a simple, if you look, layman's copy, and hope to get that out in the next couple of days.
Great, thanks, Les. That's good to know. So yeah, we will share that widely as well. I can just see Emma's is on the line after all. Apologies, Emma, that we thought you weren't with us. I can see you've put something in the comment about just picking up on a few additional measures that are required of employers. Do you want to just talk through that? If I go to you now. I think you're on mute, Emma. Hi, Emma, are you with us? Possibly some connection issues there. So she's just highlighted that employers have been asked to look at staggering start and finish times, limiting use of toilets and canteens, and having one-way systems in place within the workplace. So if you're going back to work, you should expect to see those things and that they are in place in order to reduce the risk of people coming into close contact and obviously the risk of transmission. So Amanda, you've got your hand up, if I come to you.
Yes, thank you, Emily. It was just to pick up on what Councillor Jerry Rood has said about the COVID-19 groups, and just to really highlight to those groups that have set up and obviously supporting them. There will be a mutual aids meeting, community groups meeting in terms of community support, what next to those groups being held by Carver, and obviously the county will be supporting them. That will be held on the 28th of July between 10 and 11:30, and I've put a link to the person to contact there in the chat should any of the groups that are attending today wish to attend that webinar on the 28th.
Brilliant, thanks Amanda, that sounds really useful. As I say, we've valued the support of all these community groups so much, so it's great to know we'll have some continued engagement. So I'm just having a look on the chat feed, and there looks like a couple of additional questions to come back on. So one from Carol, who has asked whether there will be medical exemptions from wearing face coverings, and if so, how you would prove this. So I can certainly answer the first part of the question, which is yes. If you have a medical condition, which means that you cannot wear a face covering, then you do not have to wear one. In terms of how you're proving that, I'm not 100% sure actually, so we will look at that and come back to you through when we send out the slides and things to people on the call today. I'll give you some guidance around that. So certainly if people are deaf or hard of hearing and they need some assistance and obviously rely on lip reading, then if you're in a business and you're supporting that person, then you should remove your face mask to help that individual. and those individuals themselves don't have to wear a face covering. So yes, there are exemptions. Additionally, children under 11 don't have to wear a face covering if they struggle to do so. So there are some exemptions to the rule. So I suppose there's a plea really to everybody that if you see somebody not wearing a face covering, to perhaps resist the urge to judge them or challenge them. There may be a very good underlying reason as to why they are not wearing a covering, but obviously encourage people to wear them as much as possible when in public enclosed places. People with unseen another follow-up question, I think, on a similar issue from Sarah. What about those with unseen disabilities? Can we have a badge or lanyard to identify people? Interesting idea. So I know during the early stages of the lockdown, people who had autism, I think they were carrying something blue to highlight the fact that they had autism. And, you know, when we were not supposed to be leaving the house more than once a day, actually, if people were finding that their relatives or people they cared for who had autism were really struggling with that, they would carry something blue and walk around, and so that they could walk around and not be challenged about that. So I think that's an interesting call and perhaps something we could look at through our voluntary sector. Amanda's just put a note in to say Helen Stewart has raised a question early on. Oh, yeah. So is there a local outbreak plan for Warwickshire, and could this be shared with the parish councils? Yeah, absolutely. So we've got a shared local outbreak plan for Coventry, Solihull and Warwickshire. It's available online at staysafecsw.info, I think. It's the link. We'll get that link out to everybody on the call today and make sure we distribute it widely to parish councils as well. Thank you, Helen. Good suggestion. Oh, Laurie, thank you. Commented about the autism awareness. Free lanyard from Tesco's to have an autism awareness sunflower. Do you want to come in, Laurie, and say a little bit more about that?
Oh, can you hear me?
Yeah.
There's probably not much more to say, just that you can apply for it through the Tesco website, and it's for hidden disabilities, and it's a sunflower lanyard. Anyone can get them, and it's obviously something that you can wear whilst in the supermarkets and out and about, and people are starting to recognise that means people have hidden disabilities.
Brilliant, that's really helpful to know about. Thank you, Laurie. Great intervention there. And thank you to Jerry. Jerry's just put a link to the Coventry, Solihull and Warwickshire outbreak plan within the chat as well. Thank you, Jerry. Janet from Making Connections, did you want to come in with a question or a comment? Because you popped something in the chat.
Sorry, I went to and then pressed the wrong thing. Just a couple of questions. We've been using visors. Are they suitable as a face covering or not?
No, so visors are one helpful protective measure. They tend to be more protective around your eyes, really, so kind of eye protection, because that's another route of transmission for the virus, but it's not really a face covering. So you should be looking at a kind of a cotton face covering that covers your nose, your mouth, your chin, and kind of fits fairly tightly around the ears, so it gives you that protection.
That's great, that's helpful.
Yeah. Thank you.
Also, another thing, we've got one of our clients who I understand the government were doing transport to hospitals when for people who were disabled and stuff, when the ambulances weren't doing that. Is that still available now?
It is available. So we've been using our community transport providers to offer that transport. So they've been fantastic. Actually, many of our voluntary community sector health transport providers have been helping out both with deliveries to people needing essential supplies and deliveries of PPE to pharmacy early on in the pandemic, but they've more recently started doing transport to health appointments again. So VASA now cover the Rugby area, and appointments can be booked through their system. Obviously, if passengers have any COVID symptoms, they wouldn't take them in. Yeah, but otherwise, no, there is support to get people back to their health appointments. And I suppose a plea and a reminder, so thank you, Janet, a reminder to people that NHS services are open. Please don't delay getting health advice if you have any concerns about any health condition. So we did see a significant drop off in people attending hospital as an emergency or GP practices during the pandemic, and some of it's starting to come back now, but there's still concern that there's unmet health needs out there. You know, if you have any concerns, you can phone your GP practice before going in, but GP practices and hospitals have put really good mechanisms in place now to keep people separated if they have any suspicions that people may have COVID symptoms, or if people are COVID free, if you like. So actually, I know colleagues working within a South Warwickshire Hospital Foundation Trust have said they feel safer in the hospital than they do in the supermarkets at many times. So please be assured that hospitals are safe to visit. Are there any more questions or comments from audience members? You can either put your hand up using the hand up function or pop something in the chat. So if you want to put your hand up, if you hover over the screen, there's 3 little dots. If you click that, one of the options there is raise your hand, or as I say, there's a speech bubble icon which will open the chat function for you. So thank you to Amanda, who's popped the link to Vassar Community Transport into the chat as well, so people can use that to book any appointments. And are there any more points that panel members would like to make before we close off, if you haven't had a chance to raise them yet? Laurie.
Thanks, Emily. I just wanted to say that I'm also a Localities and Communities officer, along with Amanda and Alistair, and will also be covering rugby for Jen's maternity leave. So I'm another point of contact should anyone need it.
Brilliant. Thank you, Laurie. The localities team have been fantastic through all of this, and they're all very friendly faces. If you want to pick up the phone to talk to them, they will find a way to help residents. I know they've been extremely flexible and adaptable. So thank you to everybody that's been supporting communities, including our localities teams, colleagues. Oh, Jerry, I think you're on mute.
No, I was just to say thank you very much for this morning, really. I think it's been really useful, and you know, going forward, I have put in chat a link to Healthwatch Warwickshire, bit of a plug. They are doing a survey. They want to hear from people who've either had COVID cases or supporting, and from groups. We're doing that across Coventry and Warwickshire, part of Healthwatch England's pulling together about what's happened on the ground in people's experiences. So if anybody wants to go to that link and tell us, that would be really good.
Second that, please do share your views. And I can see Leonie, one of our guests today, has also put a link to the Warwickshire Carver website. So they've got some information on being COVID secure in terms of community buildings and what they might look like when they open back up again. And just flagging a couple of additional events for voluntary and community groups in August. So if you want to attend a community group on return from COVID on the 12th and 13th of August, please email Leonie, Leonie, at wcava.org.uk. So this is really helpful in terms of lots of information sharing, and I hope attendees have found it useful in terms of getting a better understanding of the test and trace system and what we should all be doing to help prevent the spread of coronavirus. You know, I suppose just a final point that the virus is still out there. It is still that invisible threat that we've been living with for a few months. All these prevention measures reduce the risk as much as possible. We can never completely eliminate the risk of contracting the virus. So as I've said, if you have any concerns that you have any coronavirus symptoms, do call 119 or go to nhs.uk/coronavirus to request a test. Thank you all very much for coming along today. it's really great to have the engagement through this session, and as I say, we'll share a recording of the video and lots of information packs around supporting your mental health at this time, so supporting carers, and a bereavement guide pack that we've also put together that highlights support available. I'll also include a link to some translated materials, particularly where we have people from Black and minority ethnic groups whose first language isn't English. Would be grateful for people to help disseminate that information as well. So Amanda, a final point from yourself?
Just to say that I've actually put that final question that was raised by a resident, Jeremy James, actually in the chat. I don't know whether that's something that you actually want to answer, Emily, or get back to him. Okay.
So a resident has mentioned that they've joined the Covid19 study run by the King's College London. So this is, if people haven't seen it, it's an app you can put on your phone which asks you to log in daily and report whether you have any symptoms or not of COVID, which helps to get a really broad understanding of the picture of coronavirus within the country. Yes, I think I've also got the app on my phone. I think it's really helpful, and it's really interesting looking at the studies, the findings that they're coming out. So what this does is gives more of a sense of perhaps people that are asymptomatic as well and not going forward for tests. So we get a picture of the wider incidence of the disease. And you're right to flag, they've been identifying some interesting other symptoms. So, and as anosmia, which is change in taste or sense of smell, was quite early picked up by that app, and it has now come into the symptoms to look out for. I was also looking on the weekend, they've started to identify skin rashes as perhaps an early symptom, but also potentially a symptom that people have when they are asymptomatic. So if they don't go on and develop full-blown disease, actually some people do still have a bit of a skin rash. So it could be kind of chilblains in the fingers, or more of a kind of prickly heat type rash. So I know that the evidence from that study has been put forward for publication. So it's just going through a rigorous peer review process at the moment. And following that process, we may start to see the information around skin rashes being publicised more widely. So at the moment, I think we're aware of it, and it's very interesting and worth people being aware of that also. It's not formally within our list of symptoms at the moment, but I would say watch this space, and I would encourage people to sign up to that King's Fund COVID-19 tracker app as well. Also, I think we've got a few more comments in the chat. People sharing their contact details, so our localities team colleagues have been sharing that. Yeah, no, please do, Jeremy, please do promote that app. It's an excellent study, really valuable information coming out of it. So yeah, great. Thank you all. I can't see any other comments in the chat, so we'll sign off for now. I hope people have found that useful. Thank you all to the panel members. Thank you all. Let's keep at it. We are winning this fight. We can do it.
Thank you.
Definitely.
Cheers.